Well, have you received any of these dental flyers in the mail offering free exams, discounted procedures, and low-cost dentures? Who doesn't love a good deal, right? But at what expense? CBS 12 investigated to expose a dirty little secret many don't know about. We dug deeper and found out these so-called dental savings could be putting your health at risk. Mary Coob was seeing her former dentist for over 20 years and had built a strong bond of trust until it was suggested she get a dental plate put in.
And I thought, well, great, that's a wonderful idea. And believe it or not, to my surprise, it took almost a year of visits.
But Mary told her husband she knew something wasn't right, so she went to Spodak Dental to have it properly done after enduring years of fear and pain.
And it really hurt to waste so much money.
Was it in the hundreds and the thousands?
Oh, it was in the thousands. It was several thousand. So it was constantly uncomfortable. I can remember once or twice just being in tears that I really didn't want to go through it again. You know, the grinding and the pulling and the discomfort each time I went. At times I'd go every week and then you'd get tired of going, so then you'd make it every other. Yeah, just the discomfort and the fear. I did have a lot of fear, and once I came to Spodak Dental, I never had that fear. When I walked in and I was treated so well, from the most simple procedure to perhaps something more skilled, like implants, etc. Okay? Your fears will totally be relieved as a patient at Spodak Dental Group. I guarantee it.
Dr. Craig Spodak of Spodak Dental, a third-generation dentist, has been a leader and expert in dentistry for over 18 years.
The dental world, the corporate dental world, when it's not working well, is pushing the dentist to reach a financial goal that he must reach in order to keep his job. They're borrowing next week's or next month's revenues to make the revenues look good today, because a lot of them are publicly traded. It's growing incredibly fast. So the ADA, the American Dental Association, has some statistics that show the dental practice as a whole might be growing maybe 4 or 5% per year, but the group corporate practices are growing at like 26 and 30%. So if it's not on everybody's radar right now, it's only a matter of time before the majority, in my opinion, the majority of dentistry is provided in a corporate setting. So one day you'll wake up and that's all there is. And you won't even know about it really too, because the local dentist that you've gone to, maybe a family-owned business, will wind up selling out to one of those corporations, and the name won't even change. And all of a sudden you'll just notice certain things, like maybe they fired Sally at the front because now they have centralized billing, or maybe the materials are different now, or you'll get some different type of advertising.
He's lectured across the country, and he says these bait and switch gimmicks and new business models hurt the patients and the industry.
I feel that it's a sacred relationship. We're trained to do what is medically necessary and nothing more, nothing less. As my father and grandfather used to tell me, the best dentistry is no dentistry. So that doesn't mean prevention, but don't touch a tooth until it needs to be touched. And you can never reverse it. God makes the best teeth. He makes teeth that have resiliency and strength. And when we do our dentistry, it's good, but it's not as good as a natural tooth. So the unfortunate thing that I see is I see sometimes people coming back with elaborate treatment plans, and I try my hardest to see what that dentist was thinking, and I don't see it.
So how does this happen?
So they leave the dentist as the owner of the records, but they technically own 99.99% and dictate all the practices and what materials are used, oftentimes pushing dentists to send their lab work overseas to places like China. That's about 45% of the dental lab work done now is overseas. They don't even have to disclose to the patient. So the patient could actually have, you know, a Chinese dental crown which has, you know, harmful metals like nickel, beryllium, and lead. And that's like in the back of your head, maybe 2 or 3 inches from your brain.
Sadly, this multi-location, multi-doctor, big brother corporation model is increasing.
Because it always reminds me what these people are all about, and it's nickel and diming.
And it's starting even before the new dentists graduate, already being groomed by advertisers. Dr. Michael Paisner noticed it early on.
And the amount of inundation you get in school nowadays is incredible. These people come and they tell you, hey, we're going to give you this. We're going to give you this much money when you graduate. They give us pens and mugs and whatever. And I still have one of these mugs, but I use it as my change jar. A lot of the dentists graduating from school now, they're going, oh, I'm either all for this type of dentistry, or I want to go into private practice because I want to make that bond. If I'm working for one of these larger organizations, they're moving you around. You're seeing people on a need basis. So it's kind of like being a technician or someone who's working on a car. If something's broken, you go and you fix it, you wave goodbye, you never see them again. But that's not what healthcare is about.
It becomes numbers versus needs.
Who should be held responsible for that?
Well, I do believe that the lawmakers in the state of Florida have done a decent job as opposed to our colleagues in medicine.
The state dental boards need to be more responsible. They need to take a more active role in screening these people for licensure.
Dr. Craig has hope that there will be a shift with more laws being made to regulate these dental practices and chains, with awareness and a big tool called social media.
How is this hurting your practice and hurting our community, even in patients?
Well, it hurts dentistry. So what happens is if you go to a bad dentist or you go to a corporation that's not being responsible, it damages the relationship. People just get frustrated. Dentistry doesn't work. Dentists are in it for the money. Dentists don't care like they should. And when they come to a good dentist, maybe your family dentist, or I like to think my patients come to, they're suspect. They've already been burnt. And they start to paint with broad brushstrokes thinking that dentistry doesn't work and it's not caring. And it's really unfortunate because dentistry happens to enjoy one of the highest trust rates, sometimes even higher than our own clergy. Like, it's one of the most trusted professions. And I feel personally charged with the responsibility to continue that. And I really feel like I can affect a great deal of change, even through this conversation, just creating awareness. And also the consumer will win too, because fortunately we have review sites now. You can't hide behind the curtain. The public will bring you to light.
The patients, the pressure, and profits targeting the fearful and many on a limited budget. But there is hope in doctors who proudly serve the community and their patients.
It really strikes a chord for me because as a third-generation dentist, I really feel like my life purpose is to improve and better dentistry. And with the corporations that are out there, some of them really are not interested in that. They're interested in money, and money's fine, but money generated through a noble purpose. So the Marlins are busting all the kids out, and we're going to do all their dentistry, and we have tents set up outside, like porta potties.
That is so exciting.
It's really cool. We just connected to why we did it in the first place, and that's powerful. And people can feel that. When you speak from your heart, people hear you with theirs. And that's something I like to tell the dentists. When you're communicating what's right for them, what's ethically, morally right, you resonate sincerity, you resonate your purpose. So one of the reasons why I think we're successful is we're purpose-driven. Everybody in this organization knows the reason why we exist beyond making money. We don't exist for just as a business. We have a noble cause. We want to take care of people. We want to give compassion. Well, it's daunting when you look at all this information, and I don't want my message to be one of fear, because I want to give the consumer, the dental patient that's out there, hope. Because dentistry is really important to your overall health. It's correlated to your cardiovascular health, your cerebrovascular health. Untreated dental disease causes an increased risk of just about everything, whether it be stroke, heart disease, Alzheimer's, pancreatic cancer. What happens in the mouth doesn't stay there. It travels throughout your body. But for the dental patient that has not gone in 10 years, that's being crushed by the burden of the unknown and fear, I want to tell them, I want to speak to them that there's hope for them. There's places that do care. I'm not the only one. There's many colleagues that I have, I'm lucky to practice with, that really care about people. And that's why we got into this in the first place, to help.
If it's too good to be true, it probably is.
Do you want to discount your health? I don't want to discount my health.
Well, all corporations aren't bad, and there are so many good dentists and doctors out there. So what can you do? Since most of these places play on fear, here's some tips. Ask friends and family to get credible dentist recommendations. And also, if it doesn't feel right when you're at the dentist's office, go elsewhere. Also, check online. Do your research and check those online reviews and those rip-off reports. You can also check the Better Business Bureau, your local Chamber of Commerce. And finally, write to your local lawmakers to create more laws to regulate and protect patients.